Well, tonight we are less than 24 hours away from the first meetings on pediatric vaccinations. An FDA advisory panel will meet Tuesday to discuss doses of Pfizer's vaccine for kids 5 to 11. 28 million children fall into that age group. The shot they'd receive is 1/3 the adult dose. Pfizer says the vaccine was nearly 91% effective at preventing symptomatic disease, and there were no cases of severe side effects in their study.
It's entirely possible, if not very likely, that vaccines will be available for children from 5 to 11 within the first week or two of November.
Moderna also talking about pediatric doses. The drug maker says its vaccine shows strong immune response and is safe for kids 6 to 11. The company is planning to submit data to the FDA very soon. Well, even with those shots possibly on the way, health experts are still trying to convince parents to get their kids in line for a vaccine. A new Kaiser Family Foundation poll showing only 1/3 of parents say they'll get their kids vaccinated right away if the shots are approved by the FDA and the CDC. Here's a breakdown of that polling data. As of September, 34% of parents said they'd definitely be getting their kids vaccinated. 32% say they're waiting for the data. 7% say they'd only have their kids get the shot if it was required. Nearly 1/4 of parents say their children will not be getting a vaccine.
What I say to parents, talk to someone you trust, get your questions answered. I think a lot of those parents who are in the definitely not will shift over time as the vaccine's administered and they feel more comfortable that it's truly safe and they see what kids are able to do once they're fully vaccinated.
White House officials say there are currently enough pediatric doses on reserve to get every child in the 5 to 11 age group vaccinated. Iowa officials are getting ready to vaccinate children should the shots be approved. The state estimates there are roughly 284,000 kids ages 5 to 11 here. The Iowa Department of Public Health says we will receive around 99,000 doses in our first shipment of the child shots. Those doses are expected to arrive between October 27th and November 4th. Experts say if you want your kid to get a shot, it's time to think about setting up an appointment. The best way to do that, call your healthcare provider and ask about their availability.